Leading care teams through COVID-19 has been a challenge unlike any other. As hospital leaders struggle to retain and support an exhausted workforce, they're left looking to understand how to address the traumatic stress caused by COVID-19. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. In today's episode, Elisa Arespacochaga, AHA's Vice President of Clinical Affairs and Workforce, sits down with Dr. Brooke Buckley, Vice President and CMO of Henry Ford Wyandotte Hospital, and Robert Matheny, Manager of Neurodiagnostics at Henry Ford Hospital in Detroit, Michigan, to hear about their work on trauma-informed leadership and how they've approached leading teams in the midst of COVID-19.
Thanks, Tom. To get us started, Brooke, Rob, I really would like to hear a little bit about yourselves and your organization. Brooke, I'll start with you.
Thank you, Elisa. So my name is Brooke Buckley. I'm a general surgeon by training and currently am Chief Medical Officer at Henry Ford Wyandotte Hospital here in Southern Detroit.
And Rob?
Yeah, thank you, Elisa. My name is Rob Matheny. I am the manager of Neurodiagnostics here at Henry Ford Hospital. By training, I'm a clinical therapist, and I'm also a PhD candidate in interpersonal communication.
Great. So let's get started. I've had a great conversation with you in the past about the work that you've been doing to really understand the impact of COVID on your teams and the impact and the necessity for trauma-informed leadership. So, Brooke, I'm going to start with the first question with you. How do you feel trauma impacts an organization and its ability to function?
Yeah, thank you for that question. Rob and I have done a lot of work around trauma and trauma-informed leadership, trying to understand really what the right language is to use to describe what we're all experiencing, both individually and in our workplaces. And, as we were looking at these questions you sent us, we sort of tried to boil them down to one or two words. So for this question, the main specific answer is that organizations are stuck. And that really was the word that we came to. And so what we mean by that is that we are both individually and collectively frozen in a moment in time. And what that does is it disrupts our ability to do our standard work. It disrupts the stability of our days. It disrupts our communication patterns and our ability to think in terms of forward and long range and strategic thinking. And so how we see that in our organizations is around frustrated and aggravated communications, fractured communications, and more importantly, fractured trust amongst teams and the way that we interact with each other. But it specifically operationally affects our productivity and really specifically affects our turnover. And so our recruitment and retention, which ultimately, especially as the resources are so different than they were 2 years ago, in so many ways, that increased turnover really is driving a lot of the instability in our ability to maintain a clean and consistent workforce in healthcare. And I'll stop there.
Yeah, if I could add to that, just to put some flesh on it from a leadership experience perspective. I had an opportunity several months ago. I mentioned I'm the manager of Neurodiagnostics, but this is a new role for me. My previous role, I was an organizational effectiveness consultant. And so I was doing a session, sort of a reflection session on the pandemic experience and leading through the pandemic with some of our leaders. And I created a timeline for them that I started at the beginning of COVID coming to the US and then brought it up to the current day. And we populated it with some big milestones that our organization went throughout the pandemic. But then I started to ask them some questions like, name a time when you first knew COVID was going to be a big deal for you. What is a moment in time that you're most proud of over the last 2 years? What is a moment in time that was the hardest for you over the last 2 years? What are some of the biggest turning points that you experienced? They could have populated anywhere on that timeline, that 2-year period. But over about a 45-minute discussion, no matter what question I asked them, every answer, they populated a time frame from March 2020 to about May 2020, no matter what. And I finally, after about 45 minutes, pointed out to them and said, I've tried to ask questions that might bring you further into closer where we are now. And still, every answer is back in this 3-month period. What that tells me is you're stuck in a moment in time, and even current challenges and new iterations that we're facing, you're facing those things with a mindset and a time frame that goes all the way back to the very first wave that we experienced, and the anxiety, the unknowns, and the tumultuousness that we were experiencing at that time. And you're leading from that headspace, even though we're not there now. And that's what trauma does from a leadership perspective.
I think that realization is just incredibly profound. I know practically on a daily basis, we say that was either 5 minutes ago or 6 months ago, not really sure. I think there is something to that idea that we are just all in some ways stuck. So I guess my next question, and I'll direct it to you, Rob, to start, is how do we get unstuck? How do we change the approaches to address that impact?
I think the best way to get unstuck is to really begin to think about what leadership means from a trauma-informed perspective. As caregivers, we're used to thinking about trauma-informed care. That's a concept that's been around for quite a while. But it's new for us to think about trauma-informed leadership and what does that look like? And what I mean when I say that is specific leadership actions that keep a compassionate view to what our organization has been through and acts strategically to bring some stability, to pull us up out of that place that we're stuck from and reconnect us to each other within the organization, more broadly across our organizations, to other organizations in our profession, and then also connect us back to our purpose and why we got into this profession in the first place. And so one particular model that I have found very helpful is just lifting from trauma-informed perspectives from individual trauma. So Dr. Bruce Perry released that book with Oprah Winfrey last year called What Happened to You? And he has a really great framework for how to lift people up out of their trauma headspace and back into their kind of fully actualized headspace. And he starts with, simply first just regulate, bring structure, bring balance back to what you're doing. So from a leadership perspective, that might mean reevaluating your meeting cadences. That might mean looking at your processes and your policies that, made sense in the midst of an incident command situation in 2020, but maybe we don't need to live there anymore and we can restore some normality. The second step is regulate. Then the next step he has there is relate. So how do we create opportunities to connect to each other as leaders? We live in this world where we're together but separate. We're here on WebEx, so many meetings that I have with folks in the same building with me. I'm still, over some sort of mediated context. And so finding ways for us to connect to each other again and be able to have some of those organic water cooler conversations that used to occur and connect in our networks again and reconnect to the people who have been so valuable to us along our entire journeys as professionals. And then the last step there is reason. And that is reconnecting back to purpose. What's your why? Why did you get into caregiving in the first place? What is your vocation here? And they really do have to happen in that order. So often we're trying to talk to our teams about what's your why when they're just living in a crazy making experience and they don't care about their why in that moment. They need you to bring some sanity to their schedules and to their task list first. They don't have bandwidth to think about things like their purpose. So they really do have to happen in that regulate, relate, and then reason step. But a trauma-informed leadership perspective enacts that strategy in really specific and intentional ways.
Yeah, and if I can just sort of highlight that, we just keep coming back to that we've never been more together and more alone. And it's just such an unusual and disorienting space that we live in right now. And so it's truly that intentional redesign, looking for the places where we are disconnected and creating dis-peace with each other, and then creating that scaffolding to connect onto as we redesign the work to really connect back not only to ourselves, but to our company and our vocation, as Rob said.
Absolutely. And I really love the idea of creating the structure so that you have enough gas to even be able to think about how you're going to talk to other people. Never heard so many people say they're tired in the last 2 years as ever before. So, as you think about all of this all goes to the organizational culture. How do you rethink what that culture looks like when you don't have those water cooler conversations? You don't have those informal connections that you can make to help build that. And you have to think about what that structure looks like to make this very intentional. Brooke, I'll turn to you. How do you help your leaders address the pieces of the culture that are going to really support the team in this brave new environment?
Yeah, thank you. We sort of spent a lot of time on this particular question because this is more nebulous maybe than some of the others, because truly we need to create space. And in creating space, not only might that be a physical space to congregate, to think, to spend time, to work through things, but more intentionally, we have to create cognitive space or mental space, and have to really recognize that each of us are going to do this work in a different way. And certainly, in a world where we really are looking at diversity and inclusion in really thoughtful ways, acknowledging that each of us, depending on the day or the hour, but certainly depending on our background and our journeys, will need to process and create that space in different ways, is something that as leaders you want to be able to give clear and direct tools. And truly, this is about creating places and safety to do this work as teams. And as we were thinking through this, Rob said something that just really struck me, that was that the organization is created by the sum of individual growth. And that is, I think, incredibly profound, and as a leader, in some ways, really disappointing because there's not something there that I can fix. There's not something that I can go and just change and flip out and make it better. I have to help support all of my people to rise, to create a stronger, better organization. So recognizing, number one, that it's going to be messy, clunky. There's going to be innovation and iteration that we need to try and be safe to fail and then try again. And we need to be on the lookout for when things aren't working so that we can pivot and change directions. And we've gotten, as we've said, very good at crisis management and firefighting. But it's not that. It's an intentional redesign and growth forward into this new and different space. So it's looking for opportunities for the pieces that are missing for each individual and that are missing in the organization that connects them back to the why. So that may look like redesigning how we use our time off. It may look like redesigning how we use our time here, innovating various workday schedules around what people's current caretaker or remote realities are. It may be looking at how we relate to each other, given that we have people in different states of sort of reactionary stuckness, and how we create space for people to gracefully walk out of that if they've gotten themselves or their department in a place that is not functioning well. How do we, again, create that space to allow that department to evolve to where it needs to be for the next iteration? So truly, it's this kind of push-pull between, it starts with me. As a leader, I have to model these behaviors. And as hard as I want to lean in and solve, I need to actually step back and allow the space for the people around me to solve, while I am demonstrating the work that I am doing that on a personal and intimate level as well. So the greatest example is constantly leaders saying, take time for yourself. You need rest, you need downtime, but then are answering their emails at midnight and, maybe took a plane somewhere nice, but are still engaged in the work via WebEx. And so modeling that behavior and creating space that our team members can do that behavior and model it for the people that they work with, and then spread that throughout the organization, is probably first and foremost the most important thing we can do.
I would add to what Brooke said. In all of our management literature, we talk about leadership, we talk about management often so much as a process. We take a very engineering approach to so much of what we do, whether we're talking about throughput or we're talking about direct bedside care delivery. It's a process. It's this step, this step, this step, this step. And so we're trained to look and say, if I can just fix that one step in the process, then I can fix this. And so if I can just add an additional checkbox for people to do. Make sure you had your mindful moment, or make sure that you took your days off. I'm going to audit, who has time that they haven't taken. And if I can just fix those things in the process, then I will get us where we need to go. And as we were talking about our discussion today, one of the thoughts that came to my mind was getting away from an image of fixing a process or fixing an engine, and more shifting toward kind of the imagery of cultivating a garden. What we're looking here is to create the right conditions in which something can grow, in which something can flourish. I've heard physicians say in the past that they don't heal people, they create the conditions in which people heal. And the same is true of a garden. We don't, as if you are used to planting a garden, you know that you can't grow anything. All you can do is create the conditions in which something can flourish. And from a trauma-informed perspective or a cultural perspective of leadership, that's what we're looking to do. How do we create the organizational conditions in which people can have meaningful moments of mindful engagement and withdraw? Beginning to recognize that as leaders, our people benefit as much from our creative presence as they do from our creative absence, because it's what we do when we withdraw and we give ourselves time and space to renew ourselves, that we develop what we need so that we can show up and have something to offer the next time we're engaged again. But if we don't take those times and we don't model that, we don't create space for our people to do that, we're not creating the conditions in which folks can grow. And so much of the reasons why we don't is because of our anxious belief systems around what will happen if I pull back, what will happen if we don't have that meeting, what will happen if we don't accomplish the 72 things on our strategic plan and we only accomplish 65 of them. And so we have to begin to examine our mindsets around that and say, is this thing that we're doing, does this mindset that I'm holding, is this way that I'm leading, is it actually creating a space for healing, for flourishing, and for growth? Or is it keeping us chained to an anxious process that doesn't serve the patient or our people, but only serves the process itself? How do we create those more healing spaces?
I absolutely love that. One of my favorite quotes from a good friend of mine is, yeah, as a manager, you're entering a room is never a neutral event. You're either creating a positive environment or a negative one, but don't ever think as a leader you're creating that it's not noticed what you do. And I agree with you, Brooke, as much as it pains me to not answer emails on the weekend, because I do read them, I realize my team needs me to not answer emails on the weekend. So I think those are some great ideas about how you think about, how do you get the entire organization to create that space so that people can grow? Well, Rob, one of the things you said about the timeline you set up really stuck with me, that everything was moving at that sort of crisis management pace. And how do you go from the, let me complete all 72 items on my checklist and set a pace for the future that allows for that room for growth?
I think it starts with getting really clear about your values. If you had to ask yourself as a leader 4 basic questions with everything that you did, in this particular initiative, what is really important here? What do we value? And then if we were really doing truly what we valued, what would that look like in terms of behaviors, processes, and policies? And those 2 questions are really powerful, but going another step and saying, I know that we are human beings and we get in our own way sometimes. And so when we know what we value and we know what we should be doing if we value that, what happens for us? What comes up for us that prevents us from doing that? What are the belief systems or the policies that we have or the feelings that we have that prevent us from doing those things really well? And when we get hooked by those things, that 4th question is, what do we actually end up doing? And how does that serve us? And if we had to really pause and reflect on those 4 things and just simply say, okay, we get a clear picture of what's really happening for us, not just when we're at our best, but also when we're getting hooked and we're not at our best. And then we begin to say, how do I hold that with compassion, that stuff that gets in my way, recognizing, because shame doesn't help anybody. So if I shame myself or my team or my organization for not getting this right, all I'm going to do is be stuck in that, and that's not going to help. But how do I hold that with compassion and yet still pivot back to what we value, and allowing ourselves to be in that process? And then unfreezing time. Stop saying to ourselves as leaders and as organizations, when we get past this, we will, whatever that is. If we can just get through this wave, if we can just get through this fiscal cycle, if we can just get through this next quarter, whatever it is, when we get past this, then we will get back to what we value. Instead of waiting for a moment of time to pass by and then releasing ourselves into that, simply saying, what can we do now? I maybe can't do everything, but what can I do that's 1% more? What can I do that takes me one step closer to our values? Don't wait for some arbitrary event to happen to then unleash you to become the leader that you desire to be or that you used to be. Get back to it today, even if it's just for 5 minutes. Maybe tomorrow you'll be able to do it for 10, and then allow yourself to be in that process.
And I love the sort of buzzwords, radical acceptance around that notion, right? That owning our moment in space and time and really doubling down on a commitment to a better future, to a healthier future, to a more accepting future, however that works to describe that. But just accepting and acknowledging that we are where we are and that there's a desire to move past that. And that's not the same as a perfect journey that's going to be completely smooth to get to whatever that future state is. But it's a commitment to show up, as Rob would say, to work the session, to get through the process and just to keep showing up and to keep trying and looking towards what those next steps may be, and looking to find those steps and committing to moving in that direction. And, you asked us about our particular organization. We happen to be going through a rebranding phase, which is a very exciting and very tangible way to commit to our future. But I don't think that it has to be a actual real rebranding to be a virtual, if you will, rebranding, kind of a commitment to a future that is connected to the core values, which likely haven't changed. But the way that we live through those values has probably drifted in the last 2 years. And so that each of us recommitting to ourselves and to our connection with our organization. And it also actually, for me anyway, gives an opportunity to have really genuine conversations around team members or even ourselves who may not be committed to doing the journey, right? And in a compassionate way for people to opt out. I'm just not there to be able to make this journey. But it really helps to sort of facilitate that conversation in terms of who's ready to move forward, who's not ready to move forward, and who may just want to take a pass and excuse themselves. So it really helps to drive some of those conversations.
That's great. I can't wait to see where you all land with all of this work. To wrap us up, I'm going to ask each of you, and I'll start with you, Brooke. What do you wish you had known 2 years ago when you started thinking about this, or, when COVID hit? What do you wish you could go back and sort of tell yourself?
Gosh, so many things, right? I had really already sort of started some of the work around resilience and trying to just understand workforce stressors. Clearly in healthcare, that's been a raging conversation. And I don't think that we understood how much more raging it could get. And so for me, I think about the Stephen Covey constant or permanent whitewater vision that he has, or just specifically that we can't control the waves, but we can learn how to surf. And I wish that I could keep that top of mind, because my impulse is to try to control, is to try to lead, is to try to solve, is to try to ease other people's pain. And the reality is that it's not who we were or where we were or what it was. It's who we are. It's who we've always been, and it's who we will always be. And the better that we can just live into that surfing, the more that we can continue to live into our values and be the healthy organization, the healthy people that in my good moments, I really want to be that person. And so just staying in that space and continuing to surf is where I wish I would have been 2 years ago, and continue to redirect myself to today.
Yeah, I think for me, it would be that crisis doesn't change me, crisis reveals me. And so when I think about that, I think about all of the things that have come up for me over the last 2 years of chronic stress and acute moments of intense crisis, and where I had kind of almost these cosmic crisis moments where the rules by which I thought the universe worked, I found out it doesn't work that way. And I had belief systems around how things should be, and I was committed and stuck in so many ways to, well, if it's not this way, then I don't want to participate. And it really revealed for me what were the frames of mind that were really going to help me be anti-fragile and grow and lean in, and which ones were going to just cause me to become stuck in that quagmire. And there was a recent Washington Post survey where 3 out of 10 healthcare workers reported that they were thinking about leaving the healthcare field altogether. Over half reported clinically significant symptoms of burnout, and 6 out of 10 said that they believed that being in healthcare was bad for their mental health. And when I think about that, I think about what are all the things that we as leaders have attached ourselves to in terms of belief systems and commitments and musts that we've created, or shoulds that we've created, that aren't really true. They're just what we've set up. This crisis isn't something that is changing us. This crisis is something that is revealing us as healthcare leaders, as a healthcare industry, and what is really working, what is creating that cultivating moment for us to really thrive and grow, and what is not. And so I think I wish I could go back and tell myself 2 years ago that this is hard, yes, but this process can be something that causes you to grow if you lean into it instead of away from it.
Absolutely. I think I wish I could go back and tell myself you cannot outwork a pandemic, because I think that's where we started, because that's, we're in healthcare. We can solve any problem, and we can outwork almost anybody except, I guess, a virus. Well, thank you so much, Brooke and Rob. The work you're doing is great, and I'm really looking forward to hearing more about how you move this all forward at your organization. Look forward to continued discussion.
Thank you so much.
Thank you so much.